Good morning. Thank you so much for having us. My name is Virginia Bibler. I am the owner and music therapist at Gulf Coast Music Therapy, and I have with me Ellie Duncan, who is my intern extraordinaire. She's started with us in January. She'll be with us through June, and she's wonderful as well at music therapy. So we're honored to be here to share a little bit about what we do. And also make a little music this morning. So we're gonna share our screen.
Okay, so it's disabled for screen sharing.
Oops.
Is there any?
Yes, I can. 1 second. Wait, now I'm a little,
Camera,
we should have planned this a little, 1 second. Wait, why am I having difficulty? Exit full screen.
All right, perfect. Now and then make it. Oops. Hold on. Almost there.
There we go. All right, we are gonna start the way most music therapy sessions start. We're gonna sing hello. Hey, it's nice to see you. Nice to see you today. Hey, how are you? Hello, my good friends. I said, hey, it's nice to see you. It's nice to see you today. Hey, how are you? Hello, my good friends. All right. Typically, I would sing hello to everyone, but to save some time this morning, you can just give me a thumbs up, a thumbs down, or sometimes you're in the middle. Hey, it's nice to see you. It's nice to see you today. Hey, everyone, how are you? All right, hello, my good friends. All right. We are going to share just some really some general things about music therapy first. And then we'll kind of dig into specifically how we use music therapy for our kiddos with FASD. I do have the privilege of having the therapist perspective and the mama perspective in this presentation this morning. So I have a, almost 10-year-old daughter adopted from foster care who is on the spectrum for FAS. So yeah, please feel free to stop us as we go and ask questions. Ellie and I are both fast presenters, but we're happy to field any questions at any time. Don't feel bad about interrupting.
All right, so what is music therapy? So the dictionary definition is therapy based on engagement in musical activities, the therapeutic use of music that typically involves listening to music, singing, playing musical instruments, or composing music. And that's all kind of a complicated way to say that you use music to achieve therapeutic goals. So pretty much any goal in a child's real life could be achieved through music therapy.
Yeah, one of what I usually say to people is that we use music to work on anything and everything. And two really important parts of music therapy are that it's interactive. We are not just playing music and having our clients listen. We are oftentimes making music together. Sometimes it includes music listening, but more often than not, we are creating and playing and making music together. And the other really important part is that we use client preferred music. And this is a really important concept in a lot of different settings, right? We use music. We're going to talk about all the different places music therapists work, but it's really important to be using client preferred music. And we're just going to do a really short exercise to kind of give you an idea of why this is important. So if you have a little piece of paper, you can jot something down, or You'll have to exercise your memory if you don't. But I'm going to give you a word, and then just take maybe like 30 seconds. And I want you to write down or think of a song that that word either reminds you of, or maybe something, a song you associate with the word that you hear. It can be the first thing that comes to your mind, or you can think of something that is more meaningful. It's up to you. So the first word that we're going to do is home. So just you're thinking of a song that that either reminds you of home, or it's the one that you think of when you hear the word. Give me a thumbs up when you're good. All right. Okay, so we're just going to do 2 words today. The next word is going to be medicine. This one is trickier. One easy and one hard. Okay, so if you're willing to, can I have someone share what they thought of when I said the word home?
I only thought of the song, unfortunately, like my creative brain is like not there. So I only had to think of a word that, like I had to think of a song with the word home in it. So I was only thinking of Home on the Range.
Perfect. Oh, give
Yeah.
me a home where the buffalo roam. Perfect. Anybody else?
I also thought of the song with the word home in it, the country song, Sweet Home Alabama.
Perfect. Yes, perfect. Did anybody else think of Sweet Home Alabama? This is a small group, but in big groups, oftentimes we'll have some overlapping where more than one person thought of the same song. I often think of Country Roads, Take Me Home, Country Roads. Or Home on the Range comes up for me too. I think kind of like really quickly, Tamara, when I think about the word. Okay, how about medicine? This one is a lot harder. Can someone share?
That Mary Poppins song.
Yeah, that's what I think.
Just a spoonful of sugar.
Spoonful of sugar helps the medicine go down, right? Anybody else come up with something?
Okay, so I may have done it wrong. I thought about like when I feel like I need something, I have a specific playlist that I use. And so it's like it's worship music. So I turn to that for medicine.
Perfect. I love your answer, really, because it illustrates my point exactly. So the reason why client preferred music is the most important part to music therapy is that everybody associates music in a different way. Sometimes they overlap, right? Tamara and I both thought of Home on the Range, but sometimes they do not overlap. And what can be medicine to one person is absolutely not medicine to another person. And so it's really important for us to know our clients well and to use music that they prefer, because that's what's going to make a change for them. We see this a lot, especially in the hospital. I cannot just go into a room and play my preferred music, because that is not going to be therapeutic for the 80-year-old with dementia that's in the bed in front of me. And also not going to be appropriate for our kiddos with FASD who are 9 or 10 or 11. They're experiencing music in a totally different way as well. So client preferred music is paramount in music therapy. It is researched well and proven. And typically when we work with kids, it's pretty obvious what their preferred music is. When we work with adults, research shows that adults prefer music from their 20s, kind of that whole decade. When they're in their 20s, it's what they remember the most and really kind of relate to the most. So for me, that's 90s country. That's my jam. But it's going to be different for Ellie because she's so much younger than I am. But You get the point. Any questions about that before we move on?
Virginia, I don't have a question, but I do just want to say, again, just as a parent, but also a therapist, like when our daughter first came home from her first music therapy session, and she's gone to school and she's like, Mom, I don't know these songs. What does this mean? Because they're listening to like a kids bop and it's not something that she knows from our home. She knows worship songs from her house. So when she went to music therapy and her therapist worked with her and she goes, Mom, listen to my favorite worship songs today. Like she was so excited to go back because it was meaningful. And I think I think you just like hit the nail on the head of that meaningful connection, because if she doesn't know it, it's not familiar, it's not a desired thing, there's less motivation to keep going and participating and build that relationship right off the bat. And so she definitely knows that she can talk about those things and that it's about her interests to help in that therapeutic way. So I love that you shared that, because the very first time she went, she was so excited that she had to listen to what she knows and what's comforting for her. So that's awesome.
Thank you for saying that, Melissa. It's awesome. It's so empowering, right? As a client or a patient in a therapeutic setting, to be able to have that control, even to say like, no, this is the music I want. So definitely the most important part, really, in my opinion, about music therapy. Oh, I don't know how to change the slide.
There we go.
There we go. Go ahead, Ellie.
All right. So who are music therapists? So our education requirements are an undergraduate degree in music therapy or an equivalency degree. And then after you get your undergraduate, you go to a 6-month clinical internship, and that's what I'm doing right now at Gulf Coast Music Therapy. So I'm earning 1,200 clinical hours within these 6 months. And then at the end of 6 months, I'll take a board certification test. And if I pass, then I'm a certified music therapist. And after that, there's other certification and education available. You could get your master's degree, your doctorate. I think you're certified in NICU music therapy. There's a lot of other certifications you could get.
Right. I think it's really important also that music therapists are required to maintain their certification by getting continuing education. So all music therapists are required to get 100 hours every 5-year cycle. So we're constantly learning and trying to stay on the forefront of what is working and what is new in music therapy. Yeah, that's it. Okay, where do music therapists work? The answer is everywhere. To be honest, in Sarasota, it's been a slow road. When I started Gulf Coast Music Therapy 16 years ago, I was the only music therapist here. Nobody had heard of music therapy, and I really had to blaze some trails. But now there are music therapists that work for Tidewell Hospice. There are music therapists. We're in the hospital at Sarasota Memorial, and now I'm going to Venice on Fridays. We have music therapy in some of the private and charter schools around town. Music therapists work at assisted living facilities. We have a Parkinson's place group that we do. And what else? What am I missing?
Zoom now.
Zoom music therapy. It's really, the possibilities are endless. Over the years, I have done mommy and me groups. I have done groups for foster care during like some meetings. I've done and individual and private music therapy too. I didn't say that. That's another huge piece of what we do. So we do have a location in Lakewood Ranch. We are in the same building as Beyond the Spectrum Educational Center. And so we have a small little space there that we carved out where we see clients. And then we also occasionally will travel to a facility if there are numerous kids in a facility that we can see all at one time, or as a group, we'll travel to them as well. Cool. Common misconceptions about music therapy. So just to be very clear, a lot of times people think, oh, music therapy is just for musicians. I get this all the time. Oh, I don't play an instrument. I say, it doesn't matter. I play the instrument. So as the music therapist, we get to bring the music. And as the client or patient, you get to participate in the music. So over 15, 16 years of practicing music therapy, I have only had maybe 3 clients who were not appropriate for music therapy. They just didn't really enjoy music, or they couldn't relate in some way, but pretty much everyone is appropriate for music therapy, not just musicians. Oftentimes, I actually find musicians are the hardest ones to treat because they get really focused on the music. And as music therapists, we're using music as the tool, really. It's often, it is therapeutic. The music can be therapeutic, but we're using it as the tool to get there. And so musicians sometimes get a little hyper focused on the music part. Music therapists are not the same as music teachers, that should say. Well, that's a misconception that we are the same. We are not the same. So sometimes we do what is called adapted lessons, where we're working on teaching an instrument, but primarily we are not worried about our clients learning to play an instrument. And we are also not entertainers. So we want to make music with our clients. We want it to be a connected joint product that we're doing during the sessions. Right, take it away.
All right, so some common music therapy goals. Like we said before, with music therapy, you can really achieve any goal that you want. Virginia was talking about how she's taught kids how to brush their teeth with music, how to use the restroom with music, how to stay in their own space with music. So whatever the child's goals are can be met, or the person's goals, I should say, not just children. But yeah, this list, some of them are decreasing anxiety, decreasing depression, self-esteem, enhancing communication skills, and that can be in whatever way that the person is trying to communicate. That could be through assistive technology or verbal communication. And then there's developing coping skills, working on motor skills, fine and gross, enhancing social skills, working on range of motion, improving auditory perception, self-expression, all of the emotional things, emotional expression, identification, regulation, and reducing pain perception.
Yeah, some of the ways that we do address these goals, in just really general terms, we'll get a little more specific in a few minutes, but some of the ways that we address these goals are playing instruments together. Music therapists use drums, shakers, tambourines, really any percussion instrument. We have a closet that is overflowing with percussion instruments, and we drag them all out. Again, based on client preference and the goals that we're trying to achieve. We choose what we need for what goal. Another way that we use music therapy is lyric analysis. So maybe it is listening to a preferred music, like a worship song, and talking about what the lyrics mean. What do they mean to you? What do you think the artist that wrote them was intending to share? And how can you use those lyrics to benefit you in some way? Another way that we use music therapy is songwriting. So oftentimes we will write songs with our clients. So either their own song, or we'll take a preferred song and change the lyrics so that they're meaningful for our clients. We can use music therapy to help reduce pain and anxiety with a technique where we match rhythm, tempo, volume to what we're seeing in our clients, and then either help them relax or help them become more alert by increasing or decreasing the music as we go throughout the session.
Virginia, I have a question, and I don't know if you can go over this, or you're going to go over this later, but I just think of like so many of our kiddos struggle with like adaptive functioning, like remembering to flush the toilet, or remembering to hang up the towel, going over and brushing your teeth. Are you going to be getting into like what it would look like to be addressing that specific problem?
Yeah, I totally will.
Okay, then I'll hold.
Yeah, definitely. Yeah, so those are just some of the ways we use music. I want to show you just really quickly on a really easy song. what it looks like to match what we're seeing in a client. So this could be for pain or really just like to help for relaxation. So we call it the ISO principle. And so if I had a kiddo who was really bouncing off the walls, hyper excited, we might start singing and playing like this. Twinkle, twinkle, little star, how I wonder what you are. And then over time throughout the session, we would, or throughout, 5 minutes, however long it takes, we would slow it down over time to where we're at a more relaxed tempo and volume. Does that make sense? Okay, so moving on, I think we're about to get into the nitty gritty of why does music therapy work? Just really quickly, music therapy stimulates all areas of the brain. So there's some really cool studies out there on the internet where you can actually see some of the like MRI pictures of the brain all lit up by music. It stimulates every area of the brain. Another favorite fact of mine is that research shows the corpus callosum, which connects the hemispheres, is bigger in musicians. And why is that important for us? Well, because the left side is logic and the right side is intuition. Those are things that are often not the greatest strengths of our kiddos. And so as a music therapist and as a musician, I want to be sure that I'm stimulating that area of the corpus callosum and growing it so that those sides of the brains are connecting and talking and working back and forth. Music increases dopamine. That is a signals pleasure, and that's gonna just help with sustained engagement, but also it's just fun. So a lot of times kiddos maybe don't want to participate in therapy, like it's not fun or they don't have a good time, or it just becomes boring after a while to do the same activities or over and over again. But music therapy uses music, which is fun and engaging, and it's gonna increase dopamine. Music has inherent structure, which as a mama of a kid with FASD, structure is my friend. So we like to have routine. We like to have predictability is the next one on there. And music is inherently that way. We can tell when we're playing a song, we know what the rhythm is going to be. It's going to stay the same throughout the song. We can expect what's coming. We can tell that the song is about to end when we get to the end, and the music is a 5/7 chord. You can tell that it's about to resolve. So just the inherent structure of music, I think, is really beneficial for our kiddos. It's repetitious. We know our kids learn by repetition. And also it's fun. And research shows that kids are going to learn so much more quickly through play and having fun than just from their parents saying, don't do that or do it this way over and over again. I'm 100% guilty of just repeating myself instead of making it fun or playful or a song. But it definitely, every time that I stop myself and make it fun or make it a song, learning happens so much more quickly. And we all need that in our lives for sure. Any questions? We'll keep going.
No, it's making me think of TBRI and just the whole helping with playful engagement.
Every time I do a TBRI training, I think music therapy is literally the most important therapeutic piece here, because it is connection and it is learning through play. So we want to give you some examples of how we would possibly use music in working with our kiddos with FASD. These are just some examples that we brought today. And of course, we're also limited by the Zoom piece this morning, but I'll try to talk you through how we would use it. And please, again, feel free to ask questions. So the first one on our list is regulation. A lot of times our kiddos struggle with regulation, and especially, you know, self-regulation. And so learning how to do that is a huge goal. And music is awesome. So a lot of times in music therapy, what we will do is purposely dysregulate. So we'll do a song or a movement that is up dancing, really fun, really energetic, really exciting, get the heart rate going. And then we'll be able to teach kids a song to practice for regulating themselves back to a nice baseline. Ellie is gonna play you an example of one of our favorites.
Yes. So this is called Deep, Deep Breath. When your body says, whoa, take a deep, deep breath. Breathe in, breathe out.
I'm gonna encourage all of you to take those deep breaths for you too, because I know we all need it.
When your body says, yikes, take a deep, deep breath. Breathe in, breathe out. When your body says, stop, I've had enough, you take a deep, deep breath. Breathe in, breathe out. We could do that over and over again all day.
Yeah. So one really good way to use this song is, like I said, to teach it to the kiddos, but then have them practice it again by purposefully dysregulating and then letting them practice regulating back to a nice baseline. But another way is to talk about with them, what are activities that cause your body to say whoa or stop? What are things that might trigger you, and what are when can you use this song? So really helping them to identify when they can use it. We can also, we love to teach parents along the way too. So teaching parents and equipping parents with this song so that they can use it when their kids are in a moment where they may need assistance or co-regulating. And it kind of works really nicely in conjunction with our second star. There is increasing interoception. So if you're not familiar, interoception is the concept of what your body feels like on the inside, how your body is feeling. I've definitely found in my own daughter that this is a huge disconnect for her. It's really connecting the brain body and her brain knowing how her body is feeling. It's a hard skill for her. And so this song is another perfect example of that interoception piece. Interoception, it should say interoception. Sorry about that. So again, talking about when your body says whoa, and really focusing in on like, hey, what are your feet feeling like when we're doing that jumping song? Or what does your stomach feel like after you've been jumping around and having a lot of fun? So just really focusing on different parts of the body and how they're feeling during different parts of the music therapy session, and then how we can use that to help ourselves. One thing we like to do is you can make like a feel-good menu with your kiddos. So what are some things that you can do to help you feel good in times when you're struggling with regulation or when you're not feeling good inside your body? And so some of those things include songs that help you to relax. We often do progressive muscle relaxation. So teaching kids to kind of go through that routine themselves to help them relax if they're old enough. Increase emotional identification and expression. This is a big one. So like learning to read other people's expressions, learning to express them yourself, help you to identify them and understand the different kinds of emotions. So one of my favorite songs, I'll play for you. I don't know if anybody's familiar with Lori Berkner, but she is awesome. She has so many great kids songs. This is one that I snagged from her. This is the story of when I cry. When I'm feeling sad, that's when I cry, and it makes me feel better. It makes me feel better. You know I feel better after I cry. So we could talk about what makes you cry. This is the story of when I laugh. When I'm feeling happy, that's when I laugh, and it makes me feel better. It makes me feel better. You know I feel even better after I laugh. This is the story of when I yell. When I'm feeling angry, that's when I yell, and it makes me feel better. It makes me feel better. You know, it makes me feel better after I yell. This is the story of when I sigh. Let's all sigh together. Feels good, right? When I'm feeling peaceful, that's when I sigh. One more time. It makes me feel better. It makes me feel better. You know I feel even better after I sigh. Last one. So we can use this song to identify moments when kids are having big feelings. We can use it to look at pictures of facial expressions, and I help with identification. We can use it to change the words and write their own song about the emotions they're feeling. It's very easy to adapt and add other feelings and add other examples. So just trying to use music to connect all of those pieces for our kiddos. Impulse control is another huge goal target area for our kiddos, and music is so fun to work on impulse control because it's motivating, but also again that inherent structure, you're going to create moments where it's very clearly defined for the kids to wait or to play, and so we have a fun example of that.
Yes, so this is a call and response kind of turn-taking song.
Turn-taking is also working on impulse control, right? How many times a day do you get interrupted by your kiddo? So learning to wait and take your turn in the right spot is so fun to work on with music.
All right. Oh, I know a chicken.
I know a chicken.
And she laid an egg.
And she laid an egg.
Oh, I know a chicken.
I know a chicken.
And she laid an egg.
And she laid an egg.
Oh my goodness.
Oh my goodness.
It's a shaky egg.
It's a shaky egg.
So shake it fast. Shake it fast. Good shake it, Virginia. Shake it fast. Shake it fast. Woo! Shake it fast. So fast. Shake it fast. Oh, I a chicken.
I know a chicken.
And she laid an egg.
And she laid an egg.
Oh, I know a chicken.
I know a chicken.
And she laid an egg.
And she laid an egg.
Oh my goodness.
Oh my goodness.
It's a shaky egg.
It's a shaky egg.
So shake it slow. You know how it goes.
This is a very hard skill, y'all.
Shake it slow. You know how it goes. Shake it slow. Shake it slow. Shake it slow.
Cool. We'll stop there, but we can use that song to go back and forth between fast and slow to trick them, and just you can see the back and forth reciprocity that that we have in learning that song. And I gave you a perfect example of shaking slow, but none of our kids can do that when we start. So that has to be learned, right? And it's fun. It's fun, right? And okay, so and then increasing memory, just scooching right along. So this is Tamara, kind of what you were asking about, like how do we help our kids remember the things they need to do through music? So just one example that I wrote down to share with you guys, and then I'll kind of maybe give you a more specific example to answer your question, Tamara. But I also homeschool my daughter, my 9-year-old. And so we were doing math and coin identification. It was maybe like 8 months ago now, but she was just not getting it. Typical neurotypical math instruction in this area was just not cutting it. She could not remember. She could not tell the difference. So I said, okay, music therapist, it's time. So we sing it, and the song that I came up with, honestly, even as a music therapist, I Googled it, y'all, and I got one off YouTube, and I just sang it for it myself. But it's a penny is 1, a nickel is 5, a dime is 10, and a quarter 25. And I thought, great, she's gonna learn it. It's gonna be fine. Well, guess what? She still didn't. So then I just had to think about like, where is she struggling? And the problem was she couldn't tell based on how they looked. So then I just changed the words, and we sang, a penny is brown, a nickel is smooth, and we talked about the smooth edge. The dime is small and the quarter is big. And then once she got that part, then we could go back and add in the values. So a lot of times it's about just breaking it down as small as it needs to go musically, and then you can go back and add layers. And honestly, once we did that song, she has never had a problem identifying coins or values ever again. And she is like paying at the store and she doesn't mess up. So it was really just, she needed that musical cue to stimulate her brain to help her to remember. And it worked like absolute magic. So if there is a specific area where your kid is struggling, like Tamara, you said, like, remembering to, I forget what you said, like brush your teeth and turn off the light or whatever.
Flush the toilet, put up the towel. I mean, and it's like 17 years later, still the same issue.
I don't know how receptive a 17-year-old would be to a song about what you do in the bathroom, but as an 8 or 9-year-old, my daughter would be like fine with it. We make it groovy, and we would write a song about like, hey, when I'm done in the bathroom, did I flush the toilet? Did I turn off the light? Did I wash my hands? All the things. We would write it in a song and sing it with them and practice it with them and play instruments and record it for the parents to bring home and play and practice together as a family, and it will not be an issue anymore. It works.
I could see it being like a rap. I mean, I'm going back to the older kids, if you made it into something cooler or something like that. But do you incorporate then, how much do you incorporate the caregivers into the treatment? Because I'm imagining like, if I were a caregiver, like, would I remember this song? How do I like support what you're doing in session?
Yeah, it depends on how much the caregiver wants to be involved. So we have some who sit in on every single session. They want us to record our songs. They want to take them home and learn them and sing them. And that's amazing. It's only going to benefit the kid that much more. But sometimes parents need the break for the hour. And so that's okay too. We just take cues from the family. So we're happy to record any of our songs for the kids or for the families, whatever is needed. And yeah, I was gonna say for older kids, of course, we would make it so much cooler. So we would find a rap beat and write out the words together and rap it. Or we could use GarageBand, an app that you can get, and we could like make all the different tracks of the song and make it as cool as they want to make it. When you're incorporating the kids' ideas into the creation of a song that they're going to use for something like that, they're going to be so much more bought in because they wrote it and it's their song and their ideas, and they're going to take ownership over it, and not just the song, but also in the activity of what they're remembering to do. Any other questions?
Virginia, I don't know if, because I had asked you before, because as I mentioned, we have families from all over the state, and some they can do in person, some they can do remote. So I don't know if I know we have about 10 minutes left. I wonder if you can just talk about what can be done in person, what can be done remote. And it does make me think of also like our FASD kids going back to their act like age. So they could be 17, but they're really like 9. And so actually they could be benefiting from it. So those are all my thoughts. So go.
Yeah. So how can we serve you? We do individual music therapy sessions. We are able to bill Gardner Scholarship, which is a nice opportunity for families who have that. We can also bill Medicaid now. This is new, like just in the last year or so. So if your kiddo is on the Sunshine Network, which a lot of our kiddos who are adopted from foster care are on Medicaid and have Sunshine, we are able to bill directly. So that is such a benefit for families. And then of course we accept private pay kiddos as well. We do group sessions we can do it in the classrooms with school permission or collaboration. I don't have any problem going to see one kid, but incorporating all of their classmates, as long as the school or the teacher is happy to have that happen in their space. I think that's amazing. It's such a fun way to work on goals with a kiddo who's super social or wants to share that time with friends or classmates. Or we do individual sessions at our clinic as well. Or we can do it at the school if they have a space and they're willing to share. And then sometimes we do adapted lessons. So I mentioned earlier, some kiddos are getting music therapy and they are learning to play an instrument. My daughter is a perfect example of that. She gets music therapy every week and she loves piano and she is learning to play piano. And all of the things that we talked about are still incorporated into her piano lesson. And she works on impulse control and regulation and all of those things and memory while she's learning to play piano. A lot of times, adapted lessons for kiddos with FASD, we're just taking some breaks in between. So we'll play some piano and then we'll take like a dance break, or play some piano, we'll take a drum break. Just kind of going back and giving the kiddos what they need as they learn. And then as you asked, Tamara, yes, music therapy can be beneficial via Zoom. I think that it would not be our preferred method, but definitely for families who are more isolated or don't have access to services, we can provide Zoom-based music therapy sessions. We have a bag of instruments that we'll mail you, so you have some things at home to use and play with during the music therapy sessions. We always ask parents like, hey, just keep those put away and then let's bring them out during music therapy so that they're fun and exciting during that time. Some things translate really well on Zoom and it works okay. Some things are harder. But music therapists are creative people. And so a lot of times we can come up with a way to still benefit the client and meet the need. I would say it's easier with kiddos who are older. The younger the client on Zoom, the harder it is to like maintain attention, but also just like that therapeutic connectedness is a little bit more challenging when they're younger. But it can be done. And we're happy.
Well, and I'm imagining, I'm sorry to cut you off, but I'm imagining just still of who this could work out for, going back to the older ones, but like how cool if we're just talking about like creating music with the kid, like just such a nice, fun way to be building connection with the caregiver, where like you guys are making songs together, trying to figure out, like, I could see this creative space being really cool for certain kids. This could be a really cool space.
Absolutely. What other questions do you guys have? How can we answer some questions for you, or how can we help you?
I wanted to ask, so like any age, like just for instance, Sophia's 8. So would it be beneficial for her, like if I wanted her to start now, should she have started when she was 3, or
Nope.
like when she does like music, she likes to dance, but over the years, and mostly when she was little, if we would leave like my aunt's house in Fort Myers, if she would scream, sometimes scream from Fort Myers all the way to Northport until we got home. And I couldn't put the radio on. She used to yell, "No radio!" She never wanted the radio on in the car for years. So, and we're a big musical household. We listen to music. I can listen to music from morning till night. But if I sang, like whatever it was, if I would sing for 45 minutes, Sophia's here today, just anything for the whole ride home, and she would be okay, like better. She wouldn't be okay, but she would be better. So every day I would go home with a sore throat or a headache, or, you know, because that's the only way I could get her to calm down, mostly in the car. But I've tried, you know, I tried for years to put music on in the car, or sleepy time music to go to bed at night. I don't want it, you know, no music, just, I don't know. It was just, I wish that years ago I would have thought about music therapy, or have known that you were around, or maybe it would have helped her to calm down at those times if it was presented by you instead of by me.
Oh, it's,
you know, I don't know.
Don't sell yourself short, Cindy, because it sounds like you did exactly what was needed. We are encouraging parents all the time to sing. We didn't really talk about it, but music therapists use live music on purpose so that we can change everything about the music while we're working to meet the kids where they need to be. And it sounds like that's exactly what you did. She was averse to the music coming from the radio, and so you sang and you did exactly what was needed. So give yourself a pat on the back for that. They still benefit from music therapy, and we're going to use live music when working with her, and we're going to use what she prefers and how she prefers it. And there must be something about the radio that is a little overstimulating. Or
I just I would say the last year have been able to put the radio on for me to listen to while she's in the back seat, and it hasn't, you know, it doesn't really bother her anymore. But I mean, I never went anywhere without the music blasting my whole life, you know, and I had to not turn the radio on. And when my son would come visit, he'd be, you know, can we put the music on? I'm like, you know, we'll see. If Sophia's going to freak out, then we have to shut it. 'Cause I didn't want to do that to her. But it was just different. But you know, like I said, all that singing, everything. I'm driving to the right, like just constant singing for years and years and years, everything. That's the only thing that would most of the time get her to stop screaming in the car seat. And it was exhausting, but I did it because that had to be more exhausting, the screaming for 45 minutes for her. So thank you.
Yeah, you're welcome. Heather, did you have a question?
I do. Are most of the sessions a half hour or an hour?
Can be either. If we're billing Medicaid, they dictate a half hour, but we can kind of work around that. Or they dictate an hour session, but we can work around that a little bit. We typically decide that based on the kids' needs. So if they're able to tolerate an hour, then perfect. That's what we'll do. If not, do a half hour, and probably we'll end up doing it twice a week instead of just once.
Okay. And through Medicaid, do you need a referral from the doctor?
Yeah, great question. We do need a referral from the doctor, but I try to do all of the legwork for the parents. So I will contact them, send them a form, try to get it all taken care of without the parents having to do very much work.
Okay.
And one last question, because we're almost done, is
Tamara, it looks like, sorry, Susan had her microphone off.
I can't see you.
No, you're fine. Heather asked my question. I was wondering if we needed a referral through the pediatrician. And I love that you said you'll take the legwork out for us and do it. So no, that's what I was wondering. Thank you.
Hey, I'm a mom.
She really does. Parents verified. She did all of the legwork. I didn't have to make a single call at all. It was done and amazing. So
Wow.
100% accurate.
That's amazing. Thank you for taking that on for us.
No problem.
Yeah, so we're almost done. Just a couple of questions. So I know that, it's obvious that ideal if they can do it in person, but if it's not in person, there's still some creativity that can happen remote. Do you have, just one last question though, do you know of other music therapists throughout the state?
I do. Yeah, if someone is located in another area of the state and they really want an in-person therapist, I'm happy to connect them with somebody. If there's somebody in their area, we have kind of a network that we can reach out to and try to get you hooked up with a music therapist closer to your area.
And we only want ones that are good like you.
Yes, of course. I will vet them for you.
Yes.
Can I say, I have had my kids in every sorts of, all the types of therapy, like everything other than goat yoga, I swear. And it never occurred to me to do music therapy. Never occurred to me. Although my daughter does that, like her teachers do that at school.
Yes.
But now I have all these really great ideas and I'm definitely gonna pursue this. I don't know if I'm gonna pursue this because this is just, thank you for giving me another idea of another thing that another tool in the toolbox. I
Yeah,
appreciate it.
you're welcome. We can use all the tools we can get. I know.
Well, we are, sorry, Susan,
no,
I'm doing this. Go.
No. Virginia, I was just wondering, do you have an email or what's the best way we can contact you to find some sources where we live and maybe connect with you for the referrals?
Yes. So if you can see the screen, it's on the screen. My email is virginia@gulfcoastmusictherapy.com.
Okay.
And, my website is just gulfcoastmusictherapy.com, and you can email me through the website or directly. And I'm happy to help you figure out whatever you need.
Oh, perfect. Thank you. Yes, I just had to scroll over on my phone. Got it. Thank you.
Susan, don't worry about that. We'll send the contact information. So you don't need to even scroll. Yeah.
Thank you for all this help. I'm so used to not having any help. Thank you so much.
Yeah, and Susan, we were in sync every single time we're talking. We were in sync. That's exactly what I was going to say. That we are, not only are we going to send the recording, we will also send your contact information. And so it sounds like, Virginia, not only, maybe you can also just talk with the families to see what is the best option for them, if it's with you guys or with somebody else. So like I said, all of these trainings, and anytime you join the group, this is just the beginning of many relationships. So thank you so much, Virginia, for coming. I so appreciate it.
It was so much fun. Thank you for listening and having us.
And I'm going to officially stop the recording.